Cardiovascular pathology, subclavian steal syndrome. All right, subclavian steal syndrome really isn't that high yield, but the reason I'm going to be talking through it is just so that you understand the anatomy of the aorta and its branches, okay? So first we have the aortic arch, and the first thing coming off the aortic arch on the right-hand side is going to be the brachiocephalic trunk, okay? And the brachiocephalic trunk then gives off the right subclavian, which goes towards like our arm, our right arm, and then the right common carotid, okay, which goes up towards our brain. And then as we move further towards the arch, we finally meet the left common carotid, okay? And that comes directly off of the aortic arch. And then next is the left subclavian, which comes directly off of the aortic arch. So the left-sided common carotid and subclavian come directly off of the aortic arch, whereas the right-sided common carotid and subclavian come from the brachiocephalic, which then comes off of the arch. And for subclavian steal syndrome, what happens is that we have a stenosis of the left subclavian artery. And so we can't really fully get our blood flow to that left side of our body, the left side of the arm. And so what we do is that the blood flow then goes through the brachiocephalic trunk, and it goes up to the right subclavian, and then through the right subclavian, it enters the right vertebral artery, then travels back down through the left vertebral artery because they meet, and then through the left vertebral artery, it goes back through the left subclavian, okay? And so that's how we kind of bypass the subclavian artery stenosis. So you just have to know that the reverse blood flow is traveling in the ipsilateral vertebral artery, so that left vertebral artery, all right? That's really all that there is for subclavian steal syndrome, relatively low yield, but just make sure you know the anatomy in which arteries come off of the aortic arch.